Hi everyone, and welcome to Health Me Please, the YouTube channel where you can find reliable and up-to-date information about diseases, treatment, and prevention. Today we will talk about ischemic stroke Part 1. Stroke is classified into two major types: brain ischemia due to thrombosis, embolism, or systemic hypoperfusion, and brain hemorrhage due to intracerebral hemorrhage or subarachnoid hemorrhage. Brain ischemia can be further broken down into three main subtypes: thrombosis, embolism, and systemic hypoperfusion. Thrombosis refers to local obstruction of an artery. Embolism refers to particles of debris blocking arterial access to a particular brain region, and systemic hypoperfusion is a more general circulatory problem affecting the brain and possibly other organs. The brain is extremely sensitive to even short durations of ischemia, and multiple mechanisms contribute to tissue damage resulting from brain ischemia. This includes depletion of ATP, changes in ionic concentrations, increased lactate and acidosis, accumulation of oxygen-free radicals, intracellular accumulation of water, and activation of proteolytic processes. Cell death following cerebral ischemia or stroke can occur through necrosis or apoptosis. The immediate goal of reperfusion therapy for acute ischemic stroke is to restore blood flow to areas of the brain that are ischemic but not yet infarcted. Intravenous thrombolysis is the main form of reperfusion therapy for acute ischemic stroke. And mechanical thrombectomy is indicated for patients with acute ischemic stroke caused by an intracranial large artery occlusion in the proximal anterior circulation. Reperfusion therapy has been shown to improve functional outcomes at 3 to 6 months for appropriately selected patients when given within 4.5 hours of ischemic stroke onset for intravenous thrombolysis, and within 24 hours from the time the patient was last known well for mechanical thrombectomy. All adult patients with a clinical diagnosis of acute ischemic stroke should be rapidly evaluated for treatment with intravenous thrombolysis, and patients with suspected acute ischemic stroke involving the anterior circulation should be evaluated for mechanical thrombectomy. Use the acronym B-FAST for recognizing a stroke. B. Balance. Watch for sudden loss of balance. E. Eyes. Check for vision loss. F. Face. Look for an uneven smile. O. Arm. Check if one arm or leg is weak. S. Speech. Listen for slurred speech. T. Time. Call 911 right away. That's all for today. Thanks for watching, and join us next Wednesday for part 2 of our discussion about preventing a future stroke. Thanks for watching. If you want to stay up to date with all of our latest videos, make sure to hit that subscribe button and turn on notifications so you never miss an update. Finally, we want to remind you that the information we provide on this channel is for educational purposes only. If you have any symptoms that you suspect may be related to a particular disease, it's important to see your doctor as soon as possible.